Medicare Part D, also known as Medicare's prescription drug program, is changing in 2026. Now, if you look at your Medicare card, your red, white, and blue card, you'll notice that there's only Part A and Part B on the card. So in order to get Medicare Part D, you're likely going to have to buy that from some private insurance company. Now, all of Medicare Part D is privatized. That's why you don't see it on your red, white, and blue card. It is a separate program altogether. Now, the important bullet points of Medicare Part D is there's only certain times of the year that you can buy it, and there's only certain times of the year that you can get out of it. It also has late enrollment penalties for those that don't take drugs and don't feel like they want to buy a Medicare drug program. If you go to enroll in one later, they're going to penalize you and add that to your monthly premium. And the most confusing part of all is there's so many different options, and it's hard to really know which program is going to be right for you. Now, once you get a Medicare drug program, it's highly advised that you review your coverage every single year. Medicare drug programs are notorious for taking drugs off of their list or changing what pharmacy you can go to and changing that coverage. So it's important that every fall you look at this to make sure that your plan is going to be good for the next plan year. And there are just multiple ways to get it. Now, the ways that you can get Medicare Part D could be through your current employer. So if you're currently working and you're turning age 65 and you have drug coverage and you like that coverage and Medicare says it's at least as good as theirs or it's creditable, you can do that. You don't have to go out and buy a drug program. And that can even happen with a former employer. And those of you that are military veterans or those that retired out of the military, that is considered creditable coverage, the VA or TRICARE for life. You don't have to go out and buy a separate program. But for everybody else, you must go to a private insurance company and buy this program. Now, there's two ways that you can do that. The first way is you can just buy a drug program called a PDP or prescription drug plan. This is completely separate coverage, and all it does is help you pay for drugs. Or you could do something a little more savvy and you could enroll in a Medicare Advantage plan, which covers health benefits too, but it embeds the Medicare drug program into it. So that MAPD acronym stands for Medicare Advantage plus Part D Medicare. Now, every standalone drug program or Medicare Advantage plan has drug phases. They have 3 of them, in fact. The first phase is called the deductible phase, which could have up to $615 of deductible costs. Now, there are some Medicare drug programs that don't have a deductible at all, but they are allowed to charge up to $615. Now, once you get through the deductible, if that even applies to you, then you start paying 25% of the cost of the drug and your plan pays the other 75%. And this will go on until you have spent $2,100 in drug costs. Once you've spent that much in a calendar year, then you hit the catastrophic phase where you don't pay anything for your drugs. But concerning this $2,100, that only includes anything you've spent in the deductible phase or in your initial coverage phase. The $2,100 does not include what you pay to own the program. Remember, they're sold for different prices. And it only includes drugs that are on the formulary list. Now, the confusing part about Medicare Part D is which plan do you go with? There are so many different plans and they all cost different amounts of money and they have different coverages. For instance, some drug programs have a deductible and some don't. And each one of those drug programs, they don't cover the exact same drugs. Each drug program will have its own formulary list of drugs. That formulary is a list of covered drugs. Not every Medicare drug program will cover the drugs that you take. And another important feature is what are you going to pay for the drugs when you pick it up at your preferred pharmacy? All of these factors go into what drug program you should buy. Therefore, it makes it kind of complicated to know which one is right for you. So the best way to really go about this is to find a local Medicare insurance pro, and local's really important, and they will derive a medication list which includes the dosages, how often you take it, what pharmacy you pick it up from, and then they'll put in your county and location. And most professional Medicare insurance pros will have software that kind of does the work for you, and it'll probably narrow down a whole bunch of drug programs to 2 or 3 that'll work for you. And that Medicare insurance pro isn't going to charge you a dime to figure that out for you.